10 signs you have low oxygen levels in your blood. Hello, and welcome back to today's video. Today, we will discuss a health issue you might not have considered before: low oxygen levels in the body. At first glance, this might not seem like a big deal, but if left undetected and untreated, the consequences can be far more serious than you imagine. Let's picture it this way. Oxygen is the primary fuel that keeps the cells in your body running smoothly. But when oxygen levels drop, everything starts to go off track. You might initially feel a slight headache, dizziness, or trouble concentrating. However, if this condition persists, the adverse effects will escalate significantly. Your brain, which consumes the most oxygen, will suffer first. A lack of oxygen prevents it from functioning correctly, leading to confusion and fainting. In more severe cases, this can cause long-term nerve damage, impairing cognitive and memory functions. Your heart is no exception. When the heart doesn't get enough oxygen to pump blood, you're at high risk for serious issues like chest pain, arrhythmia, and even a heart attack. Additionally, other vital organs like the kidneys, liver, and lungs can also be affected, leading to decreased functionality and a range of dangerous complications. The consequences don't stop at health. Imagine being left in a near vegetative state, with all the savings you've worked so hard to accumulate drained by medical expenses. Your spouse and children bear the burden of caring for you while your career opportunities vanish. Sounds terrifying, doesn't it? But don't worry. In today's video, we'll help you identify 10 crucial signs that are often overlooked so you can detect low oxygen levels early. If you recognize these signs in time and take action, you can prevent these serious outcomes entirely. And at the end of the video, we'll share simple and effective ways to protect your health and your family. Let's get started. The first and most important sign of low oxygen levels is severe and sudden shortness of breath. Shortness of breath is a clear symptom, but it's often overlooked, especially when the body begins to experience a lack of oxygen. You may feel like you can't take deep breaths or breathe quickly and shallowly, even while resting or doing light activities. This happens when oxygen levels in the blood drop suddenly, forcing the lungs to work overtime to compensate. Severe shortness of breath is often associated with respiratory failure, airway obstruction, or cardiovascular problems. It can also be a sign of acute issues such as carbon monoxide poisoning or pulmonary embolism. When the body doesn't receive enough oxygen, critical organs like the heart and brain come under immense pressure, leading to serious consequences if not treated promptly. If you experience sudden shortness of breath, especially with symptoms like cyanosis, bluish discoloration, rapid heartbeat, or confusion, seek medical attention immediately. Early treatment, such as oxygen therapy or addressing the underlying cause, can prevent permanent damage and save your life. Don't forget to like, subscribe to our channel, and share this video to spread valuable knowledge to more people. We're always here to support your journey to better health and well-being. The next sign is shortness of breath, even at rest. Shortness of breath is a common symptom but often overlooked. You may feel like you can't get enough air into your lungs, even when you're not physically active or exerting yourself. This is a sign that your body struggles to supply the necessary oxygen to vital organs. This symptom is frequently seen in people with chronic conditions such as chronic obstructive pulmonary disease, COPD, heart failure, or other lung and cardiovascular issues. When oxygen levels in the blood are insufficient, the lungs and heart must work harder to compensate, leading to a persistent feeling of breathlessness. If shortness of breath is accompanied by symptoms such as cyanosis, bluish skin, chest pain, or an abnormally fast heartbeat, it could indicate a serious condition like pulmonary embolism or respiratory failure. If you'd like me to create more videos on this topic, comment yes below, and we'll make it happen. Or, if there's another topic you'd like us to cover, let us know in the comments. The third sign is cyanosis, where the skin, lips, or fingernails turn blue. Cyanosis is one of the most critical and visible indicators that the body isn't receiving enough oxygen. This occurs when the blood contains too much deoxygenated hemoglobin, causing tissues near the body's surface to appear blue or pale. This phenomenon is most noticeable in the lips, fingertips, and thin areas of skin where blood vessels are close to the surface. It may be harder to spot in individuals with darker skin tones, but it is often visible in mucous membranes, such as inside the mouth or on the eyelids. Cyanosis can indicate severe conditions such as pulmonary embolism, respiratory failure, or chronic cardiovascular diseases. In infants or young children, it is often linked to congenital heart disease or respiratory issues and requires immediate medical intervention. If you or someone you know notices blue discoloration of the skin, lips, or fingernails, especially accompanied by shortness of breath or a rapid heartbeat, seek medical help immediately. Another sign of low oxygen levels is an irregular or rapid heartbeat. This is the body's natural response as it tries to deliver enough oxygen to vital organs. When blood oxygen levels drop, the heart works harder to circulate blood throughout the body, leading to a faster or irregular heartbeat. An irregular heartbeat is often accompanied by palpitations, chest discomfort, or a pounding sensation that you may feel even while at rest. In some cases, it can cause dizziness, fatigue, or difficulty breathing, particularly in individuals with conditions like heart failure, COPD, or pulmonary embolism. If this condition persists or occurs suddenly with severe intensity, it could lead to dangerous complications, such as heart failure or cardiac arrest. When an irregular heartbeat is accompanied by symptoms like cyanosis, chest pain, or altered consciousness, immediate medical attention is crucial. Early treatment, including stabilizing the heartbeat and improving oxygen levels, can protect the heart and reduce the risk of long-term complications. The fifth sign that should never be ignored when oxygen levels are low is chest pain, a symptom often directly linked to the heart and lungs. Chest pain occurs when the heart and lungs are overworked due to insufficient oxygen. The heart requires more oxygen to pump blood, while the lungs struggle to bring in additional oxygen. Under such pressure, you may experience sharp pain, tightness, or discomfort in the chest area. This symptom is commonly seen in individuals with cardiovascular disease, COPD, or respiratory problems. In severe cases, chest pain may indicate pulmonary embolism, a heart attack, or respiratory failure. If chest pain is accompanied by shortness of breath, rapid heartbeat, or cyanosis, it is a medical emergency that requires immediate intervention. Another critical sign is impaired consciousness or confusion, a clear indicator that the brain is not receiving enough oxygen. When the brain's oxygen supply decreases, essential functions like thinking, memory, and awareness are severely affected. You may feel drowsy, have trouble concentrating, forget recent events, or lose awareness of your actions. In more severe cases, you might become disoriented, unable to recognize your surroundings, or fail to understand what is happening. This symptom is frequently observed in people with chronic conditions like heart failure, COPD, or sleep apnea. Additionally, acute conditions such as carbon monoxide poisoning or pulmonary embolism can cause rapid onset confusion. Impaired consciousness is dangerous for the patient and is an urgent warning sign. If this symptom is accompanied by shortness of breath, rapid heartbeat, or chest pain, seek immediate medical attention. Chronic fatigue is another significant sign of low oxygen levels, especially when accompanied by headaches, shortness of breath, coughing, or wheezing. When the body lacks oxygen over a prolonged period, the cell's ability to produce energy diminishes, leading to persistent exhaustion. Chronic fatigue is not just typical tiredness, but makes even simple daily activities feel overwhelming. This symptom is commonly observed in individuals with chronic conditions such as COPD, heart failure, or sleep apnea. Combined with other symptoms like shortness of breath or headaches, it indicates that the body's organs work overtime to compensate for the lack of oxygen. Next, dizziness or headaches are typical signs when the brain's oxygen supply is restricted. When the brain doesn't receive enough oxygen, blood vessels in the brain dilate in an attempt to increase oxygen delivery. However, this can create pressure in the head, resulting in headaches ranging from mild discomfort to severe throbbing pain. Dizziness often accompanies this due to imbalance and reduced blood flow to the brain, leaving you feeling lightheaded or unsteady. This symptom often occurs when you stand up quickly or change positions suddenly. People with anemia, heart failure, or chronic lung diseases like COPD are more prone to experiencing this. In severe cases, dizziness and headaches may indicate carbon monoxide poisoning, pulmonary embolism, or acute respiratory issues. If dizziness or headaches persist, especially when accompanied by shortness of breath, rapid heartbeat, or confusion, seek medical attention immediately. Visual disturbances like blurred vision are the 9th sign on today's list. This is an essential indicator of low blood oxygen levels, suggesting that the eyes are not receiving enough oxygen-rich blood. The eyes, particularly the retina and optic nerve, rely heavily on a stable oxygen supply to function correctly. When oxygen levels drop, these sensitive parts cannot perform as usual, leading to blurred vision, difficulty focusing, or a sensation of narrowed vision. Individuals may sometimes experience bright spots, flashes of light, or even temporary vision loss. Conditions such as pulmonary embolism, heart failure, or carbon monoxide poisoning can cause sudden visual disturbances. High blood pressure in the early and low blood pressure in the later stages is the final significant sign in today's video, reflecting the cardiovascular system's response to low oxygen levels. When oxygen levels drop, the heart and blood vessels work harder to maintain blood and oxygen flow to vital organs. This often results in elevated blood pressure in the early stages, as the body's natural compensatory mechanism. However, if low oxygen persists without intervention, the body's ability to compensate becomes exhausted, leading to a drop in blood pressure in the later stages. This phase is perilous, as it indicates that the circulatory system can no longer supply sufficient oxygen to the organs, potentially causing heart failure, respiratory failure, or life-threatening complications. This symptom is frequently observed in individuals with cardiovascular diseases, chronic lung conditions, or pulmonary embolism. Early detection of low oxygen levels is the key to protecting your health and preventing severe complications. When identified in time, you can significantly reduce the risk of issues such as heart failure, permanent nerve damage, or even vision loss. Early symptoms like shortness of breath, cyanosis, or an irregular heartbeat may be easy to overlook, but they are your body's way of sending early warnings. Proactively recognizing and addressing these signs will help you avoid serious consequences and improve your quality of life. Don't let prolonged oxygen deficiency damage your vital organs. Always pay close attention to your body, recognize the signs, and seek timely medical support to safeguard your long-term health and happiness. The treatment for low oxygen levels depends on the underlying cause of the issue. Oxygen supplementation is the most critical step, typically administered through ventilators, oxygen tanks, or hyperbaric oxygen therapy, depending on the severity of the condition. Suppose the issue concerns respiratory diseases like asthma, chronic obstructive pulmonary disease, COPD, or pneumonia. Doctors may use medications, respiratory support devices, or pulmonary rehabilitation therapy to improve the situation. For cardiovascular problems, stabilizing heart rate and blood pressure through medication, lifestyle changes, or medical interventions is necessary to ensure efficient blood and oxygen circulation. In acute cases such as pulmonary embolism, severe infections, or carbon monoxide poisoning, timely and specific treatment is vital. Early recognition and intervention are essential to protect vital organs, prevent long-term damage, and improve overall quality of life. Thank you for taking the time to watch today's video. We hope the information shared has helped you recognize and better understand low oxygen levels and how to protect your health and that of your family. Don't forget to hit subscribe and turn on the notification bell so you won't miss any upcoming valuable videos. If you found this video helpful and meaningful, please click like and share it with your loved ones. We'd love to hear your thoughts. Leave a comment below about the topics you're interested in so we can continue providing valuable and insightful content. Wishing you and your family excellent health, happiness, and joy. See you in the following video.